Okay, so you heard all about cool sculpting, you heard all about strengthening and toning muscles with M-Sculpt, but if you're thinking, I want something a little bit faster, I want to treat more than just a couple of spots at a time, I want to do my entire midsection or maybe my arms, my thighs, then you're in for a good time with Dr. Nowak, who's been doing awake lipos for over 25 years. He is a board certified cosmetic dermatologist. And Dr. Nowak, tell us a little more about what awake lipo involves.
Well, we're right here in the room where someone's about to have an awake lipo procedure. And so it's really an easy procedure. And that's not how it was years ago. Years ago, we actually had anesthesia people in, and it was a much longer recovery, way more downtime. And now with the awake lipo, the patient's there with us having a conversation. We had a patient yesterday, she was playing on her phone. And it's that easy that they can have that done. They walk out of here, someone gives them a ride home. The next day they are up and walking and moving, and most people at that first shower are already seeing the difference. Now, the other thing that happens with that awake lipo, not only they're awake, but we are bringing in this machine. This is Thermage, and this is a skin tightening treatment. It's radio frequency. This tip right here is going to cover that area of the skin. We're going to treat that whole abdomen. Going to shrink and tighten the skin. We don't have a study to prove that it tightens muscles, but we see it on a consistent basis that that helps to tighten it. Of course, you heard about that M-Sculpt, how we can combine that to get people the better results. Other things that we're doing to help our patients. Well, we have the in-body machine. And so this is something new here because we've always been able to check a weight, but it really didn't say, how is the patient doing? How's their health? Are they building muscle? Are they building fat? Okay. And so we talk about a healthy lifestyle, but now we have something to back it up. This actually measured and tell me how much muscle in my right arm versus my left arm, my leg. The central area here shows me the visceral fat that I got to work on, although M-Sculpt gets a little bit of that. So it's telling me, giving me some guidelines as to where it thinks I should be to be at my healthiest. So that's my goal to get there. So we'll be following along with that. And the other thing that we've decided to bring on for our patients is the semaglutide, trizepatide medications. We know that it's popular, we know that it works, but we see people that are just losing too much muscle. 40 in one of the studies, 40% of what they lost was muscle. And naturally, as we age, we're losing muscle, so we don't want patients to lose that. So we want to do it in a safe, responsible way for those patients, help them to lose, get on a healthier lifestyle, get on a better track, but not lose that muscle. We can use the M-Sculpt, the M-Face, the tightening things to help them, but we're going to lose it on a steady, consistent basis there.
I think that's one of the things our patients love here at Nowak Aesthetics is that we have so many tools, so many resources that we can bring a little bit from each service to just customize and make your plan the best one. And just yesterday, I had a patient who was coming in. She came in to do her 6-week skin tightening treatment, and she said, I love that you guys knew exactly what I needed after my procedure, and you had it all ready for me. And that means in 2 days, you're going to come and see Dr. Nowak to see how we're feeling. You would never guess someone in the waiting room just had it a couple of days ago. They just jump up, walk like nothing happened. In 2 weeks, you're coming in for what's called a lymphatic massage with our C-Wave system, and we'll get a second session of that in 4 weeks. And at 6 weeks, we're adding that Exilis Ultra Skin Tightening Booster to help out that Thermage that's still building up. A lot of our patients include M-Sculpt in their package, and they are ready to get those muscles tightened within that first 2-week follow-up, right, Dr. Nowak?
Yeah, so within those first couple of weeks, they're ready to do some good muscle contractions. We hold them back for a week, but then they're actually starting to exercise. But that M-Sculpt's going to build 25% more muscle. It's going to tighten those muscles up like 20%. But we're going to be stronger. We're going to have a better core. So we're going to function better. Our life's going to be easier, or we're going to exercise better, faster, easier recovery. So it's a great combination with those two together.
We love all the stories we're hearing of patients changing, not just the way they look, but their lifestyles too. So Dr. Nowak, besides the midsection that typically involves the upper abdomen, the lower abdomen, the waist, the lower back, and upper booty area, what other areas can we treat with the awake lipo?
Yeah. So that midsection is the most common #1 requested area, but we'll have patients that'll come back in and say, hey, let's work on those arms. Let's work on that flank or that upper back, outer thighs, inner thighs, knees. We can do a lot of areas. There's a limit to how much we can do in a procedure, and your safety is our #1 concern. But we can do a lot of areas in one procedure.
That's right. Yeah. And we also love that Dr. Nowak is super, super careful about who is the right person for this candidate, for this treatment. Who is the right candidate for this treatment? For that, we do a very thorough blood exam. But really, Dr. Nowak, who would be a good candidate for the awake lipo?
Yeah, so the nice thing, because it's awake, we don't have the risk of general anesthesia. And You know, we're looking for patients that are looking for better shape, better contour. Some people are wanting to get back what they had before. Some people say, I never had shape like this before. And so that's where it all starts. And some are just starting their journey. Some have tried so many things and they're struggling. And we can lose 5 pounds, 10 pounds, but we lose some here and here. But we can't say just lose it right here. And that's where we come in. And like a tummy tuck will make a tummy flat. They'll have a huge scar, but it doesn't balance this back here. And routinely those patients will come in, they're like, I look wide, or look at all this right here. So they'll routinely come in for us to shape and contour those areas and sometimes even improve what that tummy tuck is left.
That's right. And now, as far as downtime, like I said, we've seen patients that you would never guess had a procedure done a couple of days ago. Dr. Nowak, what's your feedback on downtime and recovery? And when do we start seeing those amazing results kick in?
Yeah, so, well, many people, when they take that first shower, already see a difference. And we'll have people send us pictures already, say, look at that, I can already see the difference. Now, that's not the full benefit. Typically, we're taking those after pictures at about 6 weeks time frame. And we're still only about 70% healed. That skin will still get better for another 3 to 6 months out. That's when we'll max out those benefits there. Recovery, it's the hardest thing for me to predict, but most people are just like you said. They come in and say, wow, that was easier than what I thought. But you know your body better than anyone. But like I said, the procedure is done in a day. No or limited downtime to recovery time. And you're up walking and moving the next day. So you are up and around very quickly with this procedure. You're going to see it quickly. 6 weeks, we're going to take those pictures there, take those measurements, get you back on that in body so we can see how much you've lost and where you've lost and if you've been able to build some muscle there.
Doesn't this sound too good to be true? Well, it's true, and you got to find out if this is right for you. So remember, at the end of our virtual session here, you're going to receive a text. Make sure you reply yes, so you can have a one-on-one with the expert, Dr. Nowak, and he can guide you on your best treatment plan. Remember, we also offer financial assistance. We work with Care Credit and Patient 5, who can qualify you super easily and get you 12 months, no interest. So there's no limitations. There's no reasons why you shouldn't find out if this is right for you. So make sure you come on by for a consult. Reply yes to that text.
All right. Stay till the end, and we're going to do a live Q&A. So we'll be right there to answer all those questions that you have about the procedure. And I know we've covered a lot, but I'm sure you have some questions. So stay till the end.
Yes.